This is really easy for us, active lifestyle. We've been both in sports and activity since we were kids, and it just made that much easier living here in Bay-Westfield. We can ski on the golf course or on the track here. We can run on the roads and sidewalks.
And the trail?
The trail. We've got bike lanes now, bike lanes in Grand Bay. We would have never imagined that, but now we have it. And we swim at the river in the summertime. It's just great. It's very easy to be active here.
Another great benefit of leading an active lifestyle is that we're often role models in our community, and we get, between my husband being a physiotherapist and me being a nurse and being active, we get lots of questions. We give out lots of training programs for running and marathons, and I think it's just nice when people see us out busy, especially when our kids were younger. I ran through my whole pregnancy, so my neighbor would say she was pregnant at the same time, and she said, well, I thought if you could run up that hill, then I'm going to at least get out for a walk. So I think that's the other real important thing, is because we're always out there, people see what we're doing and see that we're active. It gets the whole community moving.
We like to lead by example, and we like to live this lifestyle, and we'd like more people to live this lifestyle, especially with the problems with obesity that we have now and health issues. We know that exercise is medicine, and we live and breathe that every day.
Yeah, and it's actually, it's not, I guess the other important thing is it's not work for us. It's actually, especially for me, is I need to make sure I take a day off and give my body some rest. I tend to like to overdo it just because I enjoy it so much. So it's like eating, drinking, and sleeping. I think if you make the commitment and you continue to get out there and you get those feel-good endorphins, then you'll want to continue to lead an active lifestyle. Right through till hopefully I'm in my 90s.
I remember thinking when our committee first formed, I remember thinking, how long are some of these people going to be able to be on board? And a year's a long time. And in many cases I thought, you know, is this going to be a fly in the pan thing where they're going to be there for a couple of meetings and then move on to some other interests that they have. But the reality is that many of them have been on for 4 years. We've lost a couple of people, but we've actually gained more. So we have more people that are actually taking part in our committee at the committee level. And they're a committee of people that are doers. They're at the meeting asking you what can they do, how can they do things. And that's the great thing about it, is it really makes a big difference in the community.
For the Partners in Prevention and Motion Committee, the community wellness profile that HEPAC provided us was it gave us a support and a framework to follow as we were moving forward. We've never really had anything in our town that kind of demonstrated or gave us data around the health of our community. And so for us, it gave us some information about the health status, and not to mention that it also provided us information around what target population we should focus on. And that really was very unique, because we chose actually inactive adults, which was a very different target group when looking at the other wellness networks in New Brunswick.
Mr. Hanson of good old Bay-Westfield, welcome, huh?
Bay-Westfield, you guys are so incredible. Thank you for your enthusiastic response. I sure appreciate it.